Back again. It's been a little bit of time, but good to be back. I'm Tyler.
And I'm Patrick, and welcome to Podding with PT.
We have a special guest on today. JoJo Terner works for Pelvic Floor PT in Tustin. I believe it's Sarton.
I work for Sarton Physical Therapy in Tustin.
Nice. So we kind of brought JoJo on just to share her story and then talk about some of the stuff that she does and how it can help people now in like their everyday lives.
So, Jojo, just want to start, just give us a background of what you do. I hear you're very involved. So,
Sure.
So, just
First of all, thank you so much for thinking of me to be able to talk to me because I have such a passion for pelvic floor physical therapy, and we pelvic floor PTs are trying to get the word out as much as we can, about pelvic floor PT and how important it is and how life-changing it can be. So I appreciate you guys helping to spread the word. Basically, I have been a physical therapist since 1996. So do the math. It's a long time. I can't, what is it, 26 years or something like that. So I graduated from Chapman University in their PT program in 1996. When I was in PT school, we didn't have an hour on pelvic floor. This was just not even around when I was in PT school. I don't remember doing even an hour lecture on this. So I became a physical therapist. My emphasis at the time was cardiac rehab and geriatric work. And anyhow, I graduated. I worked part-time because I had my children really early on. And then I took a break from PT. I got into fitness, which is where the yoga piece comes in. And along the way in my fitness journey, someone came up to me and told me that she was going to pelvic floor physical therapy for an issue that she was having. And they were going internal and working out her muscles internally. And I'm like, wait, what? Like, that is, I'm a PT. Like, what are they doing? And I thought that was the coolest thing. So I started taking coursework in pelvic floor PT. And basically that started my journey. And I just took as much coursework as I could. And I knew that I was going to go back to work. I was sort of waiting for my kids to get a little bit more independent. And when I was ready to go back to work, I reached out to a couple of people here in Orange County. There's only a certain few of us that specialize in pelvic floor. And I was lucky enough to get a job with Julie Sarton, and she is a pioneer in this entire field. She's been doing this for about 20 years. Her uncle was an OBGYN, and he was very forward thinking, and he had patients coming in with leakage or pelvic pain, and he got Julie in on what was going on with his patients. So she was a pioneer in this entire field. I got lucky enough to work with her. That was about 4.5 years ago. And that just, from the rest is history. Here I am, a pelvic floor PT. And yes, I have been lucky enough to also have this fitness training. So I'm a dance fitness instructor as well as a certified yoga instructor. And the two go hand in hand, and we can talk about that. So that's my journey in a nutshell.
Yeah, I got lucky enough to meet JoJo when I first moved here. So I was living in Carlsbad at the time, and then when I moved up here to Newport, I was like, damn, I need to figure out something to do, like a gym or something to like take my mind off studying for the boards. And then yoga, the Radiant Hot Yoga is like right up the street. So I took a class and I was like, oh, this is actually pretty good. So I started doing it again. And then JoJo, one of the times, so I would always go in the back. I was like, all right, I do not want to embarrass myself. I was like, I'm gonna stay in the back. And then one time she's like, oh, come up closer to the front. So I think from there, she was always just been like looking out for me, which was really nice. So that was good to have like I feel like I had a second mom here when I first.
Yeah, I mean, it's kind of interesting the way life happens sometimes, because at the time we didn't know that we were fellow physical therapists. And I mean, Tyler, you just had such a gorgeous practice. I mean, you're so strong, and your practice stood out to me, and you were so focused that you caught my eye. So that's sort of how I'm like, you do not need to be in the back row. You're like a front row, which really became you had a middle row spot. But that was sort of, Tyler likes to kind of just be a little, not too much in the limelight, but I can tell your personality. And then of course we started talking physical therapy and studying for the boards, and life sometimes is just really meant to be.
Yeah, I thought that was really clutch because I was going through. I was like, "Damn, these practice tests have not been going well." But she was like, "Oh, everybody feels like you're about to fail." I was like, "All right, just getting that last bit of reassurance was nice."
Right.
Good.
Yeah, I remember that whole experience of just like test taking and oof. And so,
I don't think anyone walks out of those boards saying I nailed it. Like, no, nobody walks out saying that was easy and I nailed it.
Yeah. So
yeah, but it
thank you.
sounds like hot yoga is like was
Yeah.
that avenue for you just to find a release and
Just like an hour a day where I wasn't thinking about anything, where I was like, that was just a nice thing to like sweat it out. And I think, and kind of how I want to segue into the yoga. So for me, it was a lot about like the breathing and the mindset of like how I thought and how I changed the way I thought and what I wanted to do or wanted to see myself doing. And I caught myself in that like repetitive loop of like thinking negatively. And then when you experience negative things and you're like, okay, I'm continuing down this path. And I thought that yoga was great for like one, just learning how to breathe, because when you start to get stressed, you get caught up in like that short breathing, that shallow breathing. So I was like, that one was always good for me, was the breathing stuff, the positive thinking, just knowing that you're in control of each situation. So for you, George, I want to know, like, how did you get into yoga?
So, and you touch on so many important things right there about yoga and how they actually connect with pelvic floor PT. So we need to go back to that. But in a nutshell, I have a dance background. So in my younger life, I was a dancer. And then, so yoga for me has always kind of been easy for my body, right? Like to me, it's an hour-long dance. And, I tap into my flexibility and all that beautiful movement, and it feels so good on my body. But basically, I was a dance fitness instructor, and I found hot yoga. My cousin was the one who said, try this hot yoga studio. And it wasn't this one, it was another one in Huntington. This was years before Radiant was open. And so, anyhow, I loved yoga because for me, it was a retreat away from life. So at the time, I was a busy mom with 3 kids and juggling all kinds of things. And for me, just like going to my mat, leaving my phone outside the door, and having that 1 hour to devote to myself was huge. And so it felt good on my body. It felt right on my body. It was a great complement to the cardio workout that I was doing. And I think Tyler, you and I talked about like strength training, and then the combination of doing something mind body together with the strength training. So anyway, I started doing hot yoga. Segue a couple years, Radiant opened. My cousin and I found Radiant, and I started at Radiant um, a few months after they opened. So I've been there for about almost 10 years, I think, since they opened, and I've never been to another yoga studio since. I love it. I love the workout. I love the sequence. I love the heat. I love the sweat. I love the community. I love the people. I'm extremely close with the owner, and the owner was asking me to teach for years, and I said no, 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 because I needed my space to go and just be. It was my therapy. And then I one day decided I wanted to create a program for Radiant. And that program it was a class called Radiant Hot Bounce, which still exists. And so I decided I need to get teacher trained in order to teach at the studio. So I became did teacher training. I started to teach bounce as well as regular yoga. And so I've been teaching there for, I don't know, 6 years or something like that. So, and I absolutely love it. So that's my journey to yoga. And so you can kind of like paint this picture. I went to PT school, became a physical therapist. My husband always worked a ton, so I needed to be home with my kids. So I worked part-time until I just couldn't anymore. And then I found fitness. And then when I was able to go back to working, then I was able to kind of fuse the two together in certain ways. So it's been really fun.
oh,
Yeah, I think it was just a great environment also because it's like everybody's going through that hot room, and it's like nobody really wants to keep moving, but it was like pretty nice to have that, like the energy in there. And then also just that same mindset, what I always liked was like, okay, so we're just kind of going through this, like nobody really judges. You're just kind of going through your exercise, and it's a good like mind building, I think, for like that mental toughness because it was hard.
Right. So let's just talk about that for a moment. So it's very, very true. It's not an easy workout. And the postures themselves for some people are easy. They're not too difficult for me as an example because I'm fairly flexible and as I say my body it's that my body lends itself to that. But then you add in the heat and you add in the pace and you add in how you're feeling that day, what you've eaten, what you've drank, how hydrated you are, and it's a whole different experience. So it becomes very challenging and it becomes very kind of mind. That's where the mind body component really comes into play because you've got to calm your breath, you got to calm your mind, you got to, really kind of like say to yourself, I can do this. If I can just remain calm, I can do this. And that is really a lesson for the outside world off of the mat, right? So life gets very challenging. And we have to say, okay, just take a breath and I can do this. And just kind of step by step go through it. And in addition, you're right, Tyler, in that room, it's just, there's no judgment. We say in the beginning of class, there's no judgment, there's no competition. I mean, this is your personal practice. This practice is all about you and you. You just need your physical body and you need your mat. And, it's just so therapeutic just to have that quiet time where you don't have to even smile. You don't have to smile. You don't have to interact. You don't have to laugh. You don't have to talk. You can just be inside your own thoughts. You can be inside your own body and, you can work out issues if you're feeling stressed about your boards or you're trying to, they're just times, that practice is designed so it kind of starts slow, it builds. And then we have a little break and we get to lay down in Shavasana. And that's a little reset for the next part, which is high energy. And then after that, we have another little reset. And then we move into the floor series. And so there are times during that practice where you just get to, what I like is tap into that parasympathetic nervous system. And that's where this really lends itself well to pelvic floor PT, because in life we're constantly worrying and going and it's go 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 and do and like you have your parents on the East Coast and your families and stress about life and this and that, and we have so much to think about all the time, so we run in that fight or flight, that sympathetic nervous system state, and the body needs to come down to that parasympathetic rest and digest state for healing and for growth and just to find balance in the body. And as we know as PTs, balance is huge, right? So as much as we teach our patients how to get stronger, we teach our patients how to become more flexible. And so it's a huge balance. So that's where the breath comes in. The breath kind of slows the body down. It kind of keeps the mind calm. And that's aside from the PT piece, which is breath to movement. And for proper core engagement, exertion happens on the exhale. So we can kind of go through this if you guys want to, but
yeah, let's do it.
Okay. So let's transition into what I do. Okay. Is that a good time to do that?
Yeah.
Okay. So as a pelvic floor PT, people say, what do I do? And I like to say I deal with bowel bladder, and sexual function. I also treat pre and postpartum women. And then there's another pain component too. So we see pretty complex patients with nerve issues, pudendal neuralgia and other nerve issues. So staying away from that for just one moment, and if you want to, we can touch on that too. But, and I see both men and women, by the way, we may even be equal 50-50 in our clinic or pretty close to it with men and women that we see. So a lot of people, that surprises a lot of people. Our work is both external and internal. So we we go internally, both men and women, vaginally and rectally. And obviously, with men, we go in rectally to be able to palpate the pelvic floor and kind of see what's going on with the muscles. So I absolutely love my job. For me, it's like working on an elbow or a knee. It's like not a big deal at all. I always tell patients that, or patients agree with me, the hardest thing to do is to make the phone call to come into our office. The second hardest thing to do is that first appointment and walking into the office. And once you've come into my room and had a treatment with me, like you're comfortable and you're sold. And nobody ever has a problem coming back after that first visit. So we make our patients feel super, super comfortable. So anyhow, getting back to breathing, I deal with a lot of urinary leakage, let's say. And so a lot of women come in and they cough and they sneeze and they pee. Or they'll be in, you know, like fitness class and they'll pee during their practice. And this is super, super common. And they think that their pelvic floor is weak, so therefore they're leaking. But in actuality, most people come in and their pelvic floor is actually too tight. So that is where I will never tell a person to do a Kegel exercise. And if you're hearing the word Kegel exercise for the first time, have you guys heard about a Kegel exercise?
Yeah, unfortunately, I think I use it more than I should then.
Okay, so this is
back pain.
right. So, you want to sort of be careful a little bit because it's easy to talk about the pelvic floor and Kegel exercises and engaging, but I'll never tell a patient to Kegel until I've actually given them an internal assessment to determine if their muscles are overactive and weak or if they're truly weak, right?
Yeah,
So,
because in class, that's kind of like I feel like is
The standard, they just say, and I guess because we don't get that much schooling on it, so the overall thing is say most likely it's probably weak. See if they can do Kegel exercises to strengthen the pelvic floor. And usually, because most people don't do them ever, I guess I don't know if we kind of assume that since they don't do them that it's probably weak, or as in the way that we think.
So and I understand because obviously, unless you're a trained pelvic floor PT, a regular PT is not going to do an internal assessment. Although you can under, our Practice Act, but you're probably not going to do that. And quite honestly, we don't really have any male pelvic floor PTs, although there are some that exist in the world.
I've been thinking about it pretty heavily.
So you know what? It's a great thing to have under your belt. I would feel that it's a little harder probably for a woman to like buy in with going to a male pelvic floor PT. And then men go either way. Like some men are, I'm just speaking super honestly from experience, but some men just don't care. And I mean, I've had guys come to me and, like we clear up their issues pretty quickly. And they say, my younger self, I would have never done this. But like now I'm older. I don't care. Fix me. Do whatever you need to do. Don't care. Some men are just not comfortable with like another guy, like, So anyhow, but you know what? And there were some guys in my, I took Herman and Wallace, some of their pelvic courses, and there were a couple guys in there. So go for it.
The APTA Pelvic Academy, I believe, or pelvic section, they have lectures and things that are just available for free if
yes,
you go check them out. So I've watched a couple of those and just trying to get familiar with just the experience of hearing from some of the things people deal with is like mind opening. It's like there's so much that people are dealing with that they don't have to, or they can get help for. I could say.
You're so spot on with that. You're so spot on. It's so usually our patients, they've seen 5, 6, 7 different doctors, and every doctor's like, there's nothing wrong, there's nothing wrong. And finally, they are researching and they find us online, or somebody mentioned something about pelvic floor. And for the first time, they're like, we can confirm exactly what they're feeling and what they've been experiencing, and we can really help. So I mean, I think you should completely go for it. Because first of all, having the knowledge base is huge. And, you can absolutely, start a little wing off of your practice in pelvic floor too, but just understanding the body a little bit better, and just looking for signs of pelvic floor dysfunction is huge. It's great.
I think my question for you, JoJo, is what kind of patient population do you see? So like you said a little bit like the neuralgia. Do you see low back pain usually in your clinic?
Yeah, we see. So a lot of there's definitely a large portion of our patients that experience sciatic issues and low back pain. So then we have to kind of figure out what's going on. Now, the thing about pelvic floor PT, I wish it was a little bit more simple than it is, but it starts to take on a whole life of its own, which is super cool. And it just keeps you're always learning something new. So, some of the nerves from the lumbar spine, first of all, some of the nerves from the thoracic spine go around and innervate the abdominal muscles. So we started talking about breath and exhale and exertion and engaging the deep core. And by the way, when I refer to the deep core, there are 4 structures to the deep core. Do you guys want to take a shot at what those structures are? Or do you want me to just tell you?
I think the diaphragm's one of them.
Correct.
Let's see.
Transverse abdominis.
Yes.
Let's see. Oof.
Think Coke can in the middle of the body. What's on the opposite side of the diaphragm?
Go ahead, Pat. Let's
What do I do? What kind of therapist am I?
Oh, pelvic floor.
Yes. So you have your pelvic floor here, and you've got your diaphragm here, and then you've got your transverse abdominis. So here, and you've got your transverse abdominis here. And what would you think the deepest layer of back muscle is?
Multifidi.
Correct. So the multifidi, the TA, the pelvic floor, and the diaphragm form this little canister in the middle of the body. And the purpose of that canister is to control intra-abdominal pressure. So if you're weightlifting, if you are picking up one of your kids, so this is where low back pain comes in. So you got someone who comes in and they do lifting exercises, or they're picking up their kids, or they're weightlifting and they're complaining about back pain. We start thinking about, well, how are they controlling their intra-abdominal pressure when they're lifting? So are they taking that inhale breath and on their exhale engaging? So bringing the transverse abdominis in, bring the pelvic floor up, which by the way go very hand in hand, those 2 muscles. So studies show that when one is fired up, the other one's fired as well. Okay. And then when you're nice and engaged and pressure is not going to push out in any direction, that's when you're not going to injure yourself doing any activity.
So I think my question for you would also be in the example you gave earlier of women lifting, and sometimes they pee while they lift, if it's like, or even like a really heavy lift. I've seen that before with like deadlifting.
Mm-hmm.
Have you heard stories of that, or like do you treat that as well in terms of like the heavy lifting?
This was also my question as well, because in the past couple of weeks there was a viral video of this power lifter. She was going very heavy with deadlifts, and each rep there was some leakage. And so for me, as like, I kind of took it as kind of normal for a power lift to see that as a power lifter, but then it's spread it so much throughout just everybody on like Twitter and social media, like, there was a range of emotions and opinions covering.
All right. Well, let me set the record straight. Not that I am any authority on this matter at all, but leakage with that or with anything else, a cough, sneeze, or a deadlift, is common but not normal. Okay? So leakage is not normal. Like, we are not meant to walk around and pee on ourselves. Okay? So then you have to ask why this is happening. And when I have a patient that comes in with this issue, and I haven't had like a major deadlifter, but like during the there was a time where all that boot campy stuff, CrossFit was like really popular, and we just had this influx of women that were just doing CrossFit and just basically leaking all the time. So typically a patient who comes in and tells me that they're a weightlifter, I already know their pelvic floor is tight. Okay. So I would never, ever, ever in a million years give a Kegel exercise to a weightlifter who's peeing, because basically what's happening is from all of that repetitive stress over time, their pelvic floor it's gotten so much pressure that those muscles are just tight. Okay. So those muscles, from all that pressure, all that impact, they're tight. So they're kind of no longer working in a way. So the way we kind of describe it is our arm and the bicep. Okay. So every muscle, as you know, has to be able to go through its full length in order to contract and to become most efficient. And so what happens is the pelvic floor, it ends up kind of getting stuck right about here. And then you do a deadlift, which stresses that inner core system that we just talked about. And guess what? Those muscles have nowhere to go because they're in this shortened position. So first, what we need to do with that patient is we need to go in there and teach them how to lengthen those muscles all the way and release all of that hypertonicity, is what we call it. And then we have to be able to teach them how to use proper mechanics and engage their deep core, and then be able to do their activity. And then, of course, have them do a regular stretching, breathing program to basically relax all these muscles and keep them relaxed at baseline.
Yeah, that's really interesting, because my initial thought, like kind of going back to school, is always like, okay, if leakage is happening, is it that they can't control and like have the strength in the muscles? Which I guess we don't really look at it in two ways the way we should. Is like, is it weak and tight, or is it stretched and tight, or weakened? Yeah, weakened.
Is it weak? Is it simply weak?
Yeah.
Or is it overactive, hypertonic, and therefore it can't function properly? And so that's a tight muscle.
Interesting. Okay. My other question too is, so I've been doing a little bit more with like pelvic tilts and trying to do certain dissociation things. And a lot of times when I find someone with a shoulder problem or elbow or whatever it is, they also can't control pelvic tilt smoothly in like a static standing position. So they always kind of have that hitch going into a posterior pelvic tilt. So I don't know if you get people also that come in with like shoulder pain or upper back pain that you also see, okay, here's a link that I have to the pelvic floor.
So personally, I can't say that I have had a patient. I usually see it the other way. I usually see the person coming in for a pelvic floor issue, and then what happens is, in our assessment, we look at the entire body. So we look at what's going on from above and what's going on from below. So I have my little pelvis right
there. Nice.
Yeah.
Okay. So I can give you the little 1-2 on the pelvis too. But basically, we're looking at everything going on above and everything going on below, because the pelvic floor, which is all of this rubbery stuff here, and I can give you a little quick anatomy lesson if you want. But, the pelvic floor translates all forces from above and all forces from below. So we have to look. So for that patient, you have to look at the relationship of the rib cage over the pelvis. So the rib cage should sit over the pelvis. Okay, so in your patient with a shoulder injury, I would see what's going on with the rib cage and the pelvis. I would assess all the tissues from the diaphragm down through the abdominal wall and see if they can turn on their transverse abdominis, because the transverse abdominis, which is a postural muscle, needs to be able to kind of be on a little bit during standing, let's say. So when that's not turned on, you're either going to fall into an anterior tilt, or for some people, a posterior tilt. But if they're in a posterior tilt, then everything's just out of alignment, period. And of course, like, I'm not the orthopedic PT, but I know a little bit about a lot. And obviously, they're kind of dumping here too, which affects the scapula, which affects the position of the shoulder joint and all that other stuff. So look at look at their posture. That patient I would do postural training with.
Okay. Yeah, interesting. So what is kind of like your assessment look through then? So when you say you look at the whole body generally.
So our patients come in, and our initial evaluation is basically we get them pretty much all undressed. They're in a gown, and we start doing a postural screen. So we look at their head placement. We look for, for good spine alignment. We look for scoliosis. We always check hip level, hip alignment. We can correct any kind of asymmetries in the pelvis. We look to see what's going down below, what their feet are doing, what their knees are doing, what their hips are doing. Then basically, and I look for tissues, like, you can always look for like little pulls and things like that. And that's usually giving you some information about, okay, what's going on at this, like at L3, because there's like some fascial pulling going on. And then we basically look at their range of motion, their lumbar spine range of motion. We look at, in standing, we look at what the sacrum and the ilium are doing, because that is a very big piece of our puzzle. And then we get them down on the bed. We do, we look for range of motion. We look for hip alignment. Then I go into the abdomen. The abdomen gives me a ton of information about a patient. So I always look for like what's going on in the abdomen and how does the fascia feel. So I look, I basically do some skin rolling, and I massage, and I can start to feel what's going on even in the bladder, if there's any pain, if there's any dysfunction, if there's what's going on there. I work a lot on the abdomen. And then, of course, we go internal, and we assess external pelvic floor. We assess internal pelvic floor. We'll have them do a contraction to see what their strength is like, and see if we can reproduce pain or whatever it is. And then we kind of come up with a theory about what's going on.
Interesting. Okay.
Nice. I do. So from the evaluation, how are your treatments like? So I know your history of yoga. For me, I've been doing a lot of like, all right, breathing. All right, let's take a step back, because they're in a vulnerable place coming to you for physical therapy, even more so for I would imagine for pelvic floor. But just that we touched on it earlier, just how it's important to take the step back, breathe, settle down. And then for me, I always like to bring it back to progress and awareness of where they're at, because I found that people see where they want to be, but they don't ever look at, all right, I've made progress to get to this
Right.
point.
Every little tiny gain and step is a huge accomplishment.
Right.
And also, healing is never linear. Healing is not linear. So remember that healing goes like this. Like, you can have a few flares, you can have a few setbacks, and that doesn't mean you're going back to square one. That's what healing is like. So remember that too. So I tell my patients that diaphragmatic breathing is probably the most important thing that we're going to teach our patients in pelvic floor physical therapy. And basically, because of my yoga training, I typically do a little guided meditation in my treatment sessions to bring their nervous system down. So, there is with the pelvic floor. So the pelvic floor is innervated by the pudendal nerve. The pudendal nerve is made up from S2, 3, and 4, the roots of S2, 3, and 4, okay, the nerve roots. Those three nerve roots fuse together and form the pudendal nerve. The pudendal nerve has a bit of a circuitous root. Then terminally it splits into three branches: the dorsal branch, the peroneal branch, and the inferior rectal branch. And so the interesting thing about the pudendal nerve is that it's highly influenced by the autonomic nervous system. Like I like to tell patients, if you're really stressed out, like you're waiting for that board exam to it's coming out on your computer in 1 hour. Like some people get like diarrhea. Okay. So, or you've got to pee 15 times in that hour, so this part of our body is very influenced by that nervous system. The body in general is influenced by the nervous system. So I love the fact that you introduce breathing into your ortho practice, and it's a way just to reset. It's a reset. And it's a way just to calm the nervous system. So diaphragmatic breathing is basically taking that long, rich inhale and allowing the belly to expand and the rib cage to expand in all directions. So it's not using all the accessory muscles, but it's using the diaphragm to kind of expand the belly and then allow it to recoil to neutral. And this is a beautiful way to calm the nervous system. This is also a way to mobilize the pelvic floor. So the diaphragm, as we talked about earlier, and the pelvic floor sit like this. And as you inhale and the belly rises, that diaphragm descends down into the abdominal cavity and the pelvic floor descends. They move together like a piston. So as that pelvic floor descends, it kind of lengthens and opens, and then it comes up, okay? And that's how we end up lengthening our pelvic floor. So you're doing even more good than you know of doing breathing with your patients, because you're calming and lengthening their pelvic floor too.
Nice. You had me thinking about it a little bit more as you were saying it too. I was trying to do some more breathing. But I think another thing that you touched on that's really important, that goes hand in hand with that diaphragmatic breathing, is like the parasympathetic nervous system kind of getting more activated. Whereas I think people don't realize how important it is to take away time from like screens. So screens, work, eating, all that type of stuff is like, all of those are going to drive that sympathetic nervous system up. And then not realizing, okay, stopping and taking a breath, like a breath, literally just taking a deep breath, how that does so much good. So I think, how have you seen that with, or like the things that based on yoga and the pelvic floor, what those benefits kind of are?
Honestly, I think it's life-changing in both avenues, in the yoga room as well as as well as my practice, because some people walk into yoga, that's their therapy, for whatever's going on in their lives. Like that is their therapy, getting away from the screen, getting away from their phone. I always tell my patients in those shavasana poses how important it is to clear the mind, to focus on the breath, and just disconnect from the outside world, and just to allow yourself to fill up your own energetic cup. And it's therapy. When you walk out of there, you feel it's that's the mind body component. So they work hand in hand, and we can't always be overtaxing the body and the mind and being in sympathetic overdrive all the time.
Yeah.
And then in my practice, obviously pain and even in your practice, someone who's in pain, their nervous system is just spiraling out of control because that pain is all they can think about.
Yeah,
right?
definitely.
Hmm.
And so whether it's in my practice or your practice, they're just, they can't figure out. They've gone to doctors, they've done this, they've done that, and their pain, they just can't get a hold of their pain. Well, they need to learn. I mean, I always teach my patients meditation, diaphragmatic breathing, number one, meditation. And nowadays there's so many YouTube meditations out there. You don't even have to pay for like Headspace or, whatever it is. Cause I
I just
sometimes,
downloaded Calm, so
yeah, I know. I've done that too. I've done that too. I paid like my $60 for the year, but then, yeah, I got a little smart. Sorry, I'm not, sorry, Headspace. Um,
Yeah.
um, but, whatever works for you, but you can YouTube all this stuff and, hot baths,
Yeah.
massages, um, Epsom salt is magnesium. Magnesium is a calming agent.
Mm.
And it's also helps with constipation and things like that because allows everything to just relax. Um, so those are kind of the things that we talk about with our patients.
Uh,
And
interesting.
you can do that with yours.
Yes. Do you work with athletes at all? Because I know from at least with when you go parasympathetic or sympathetic, it's important for like high stress situations when you go into like that flow state, or someone like a sniper who needs like that just that level of focus and clear headedness. Like, do you see athletes as well? Because I feel like that's a good way of kind of mixing the two.
So I personally don't see any sort of high level athletes. We do have a couple PTs in our clinic who are OCSs too. So I think, I know that there's professional skateboarder and there's some other athletes that come through. But I will tell you, I treat women who are about to have babies and we talk about what's going on during labor and how to get the pelvic floor to relax and how to tap into that nervous system. And so there's a whole component there where you're in that moment and you really have to focus on keeping calm and still. Those are
It's
my athletes.
it's crazy, yeah. And I think it's wild when I ask someone who's so I usually have women that come in with back pain a lot of the times, and they've had kids like two, three. And I ask if they ever go to pelvic floor PT, and more than none, they all say that they've never even heard of pelvic
I
floor
know
PT.
it's really a shame because in certain countries in Europe, it is standard of care that you have a baby and you go to pelvic floor PT. And it's a shame that that is not standard practice here. And the way that I like to say it, especially after a C-section, um, but even after a vaginal birth, that is a traumatic. That's first of all, that's surgery. That's big surgery, and it's a traumatic experience in the body. So what I like to say is that it's such a shame because if you have a rotator cuff repair and you go back to your doctor at 6 weeks and your doctor says looks great, go to PT, do your PT, keep going with PT. So with women, we go back to our doctor for a 6 week checkup and our doctor takes a look at our tissues and makes sure that the incision or whatever is healing and says looks fantastic, you can go run, you could go lift, you can go have sex, you can do whatever you want, you're great. Where's the PT, where's the PT referral at that point? What's the difference between it's in your shoulder or in your vagina?
That's really crazy to me that that's not even a thought or like a step in the process.
Right. And so you with your patient with low back pain, you definitely have to look at you have to look for if your patient has DRA. So diastasis rectus abdominis, so a separation in the abdominal muscles. And if there is separation in the abdomen or weakness in the abdomen, obviously getting back to our inner core, pressure is going to look to escape. The pressure is not being contained properly. They're going to probably have pelvic floor pressure or leakage or some kind of prolapse going on. They're going to have back pain, and they're just doing so much damage to their bodies because they can't contain that pressure. And that woman probably has another kid at home who's probably 2.5 or 3 that she has to lift not to mention her stroller and whatever else. But, I mean, you have to really like look at the big picture about what's going on.
Mm, definitely, yeah. I think especially after I was like, that's a very traumatic experience of like if you have to have birth vaginally. I feel like even still, that's a lot to those tissues, a lot of stress to those tissues. And then now you think either you do C-section, you have to cut like the horizontal versus verticals. Like either way is going to cause some type of trauma.
Mm-hmm.
It's like, and then
For
if you
sure.
go to any type of therapy afterwards, it's like then it just starts to compound. Pretty
I
crazy.
mean, I've seen patients who've had babies who have massive tailbone dysfunction afterward because their tailbone was displaced during labor. Um, I work a lot on C-section scars and scar mobilization and making sure that, everything's healing and not keloiding and all of that. And then, of course, I mean, a woman who's been pregnant for all those months, I mean, her whole abdomen has been extended. All those tissues have been over lengthened. The thoracolumbar fascia in the back is usually a bit tighter to compensate for that. Their center of gravity has shifted, so you have to look what's going on with the pelvis. So you have to really look at, the entire body to see what's going on.
Yeah, I have another question for you in terms of you kind of brought up balance in terms of how you treat, but also some of the stuff. If you're familiar with, are you familiar with postural restitute inspiration?
No, what is that?
They go over a lot of like breathing, and I'm not too well versed in it, but I just wanted to know like because they talk about how asymmetries there are in the body. So right side because of the way your liver is heavier, or your lungs heavier on your right side versus on your left side. So there's typical patterns that you're more likely to breathe. Like you're more likely to use the front of your left rib cage to
Hmm.
like hold stale air there. But then they talk about how the diaphragm goes into the hip flexors like the psoas and then deal with the pelvic floor. So
Mm-hmm.
in terms of asymmetries, is that something that you factor in, or are you more so like, can I get it balanced on both sides?
I don't look at it from that point of view at all. Um, so yeah, I probably just try to get more symmetry just kind of through just neuromuscular connection and activation.
Okay. Yeah, I feel like then it starts for me. It's just a little more complicated. I was like, I'd rather just let me say balance both sides.
And also, you'd have to be a visceral specialist to kind of know what's going on viscerally, to make the body kind of be heavier on one side or weaker, or on the other side. So,
Okay. And do you have like any tips like for people in their daily life? Just like, hey, these are one or two things that like every morning, just try some of this. Like maybe if it is the breathing is one of them.
for sure. So first of all, sitting for 8 hours a day is not a good thing. So, someone who's very sedentary it's not good for the pelvic floor at all because that pelvic floor needs to be able to like move and breathe and glide and do its job. So, someone who sits a lot, not very healthy for the pelvic floor. So, for that person, I'd say every hour, get up and do a stretch or, just move. Um, so again, it's about balance. It's about keeping the pelvic floor strong and flexible. So in terms of the flexibility, I would tell everyone to do some diaphragmatic breathing in a day. That's just healthy for the nervous system. It's healthy for the diaphragm to move the diaphragm, exercise the diaphragm, and mobilizes the pelvic floor. And then I would say spend some time in like happy baby. Let's go back to yoga. So butterfly stretch, happy baby stretch, child's pose. Um, those three right there are awesome stretches that put the pelvic floor on slack and allow the pelvic floor to like lengthen and relax, right?
Mm-hmm.
So they're great for the back. They're great for a lot of things, but they're really, really good for the pelvic floor. Doing hip flexor stretching so that iliopsoas muscle goes right through the pelvis. So keeping that, also stretch because you're sitting all day. A lot of people are sitting all day. So the psoas muscle is basically going to be in a bit of more of a shortened position, right, for someone who's sedentary most of the time.
Yep.
So stretching out the psoas muscle, and stretching it out I like to do like a um, what do you call it? Like a runner stretch. What is it? A runner stretch on your knee?
Yeah, with the left side lying or an contralateral side bend.
Yes, exactly. And you can even turn up a little bit. So you're thinking about where you're getting the psoas, right? From the spine, and thinking about taking it all the way from the spine all the way into the hip.
Okay.
So really kind of, getting that into those kinds of stretches. And then turning on the transverse abdominis. So a lot of people don't know how to do that. And I think that that is a key player for everything we do.
What's
And
your
again,
go-to cue for someone to?
oh, okay, so my go-to cue. So first of all, we know that the transverse abdominis is horizontal, correct? Those fibers run horizontally. So my cue for that is you take an inhale breath, and on your exhale, I want you to draw your belly button in toward your spine as if you're tightening up a tight pair of jeans. So like think about you're trying to put on a pair of jeans that's two sizes too small for you. So you're
Okay.
trying to basically bring that lower piece of abdominal muscle like up and in.
Ah,
Okay?
okay.
Mhm.
And
Nice.
there's your TA right there.
Perfect. Okay. I do have somebody right now where it's trying to start that cueing and it's like I'm trying all the ones like the brace or like trying to bring your belly button close to your spine. I feel like it doesn't connect as well sometimes.
Yeah, so try that. And obviously what you're looking for always is doming and tenting with your patients. So you get them into you get them into a plank or a modified plank or whatever they're doing. Or even I mean, I look at my patients right from when they get onto the treatment table for the very first time and they lay down or they get up and I can see exactly what's going on in the abdomen and how they're controlling their intra-abdominal pressure right there. So
Okay.
if you see any coning or tenting in the abdomen, you know that they're not engaging their transverse abdominis and they're not controlling that pressure, and therefore either you need to teach them how to engage it or they're just too weak to get up like that, and then you of course have to teach them proper mechanics.
Wow. Okay. Yeah.
Nice. So what advice would you give for students or new PTs thinking about getting into pelvic floor therapy or learning more about it?
Do it. The advice that I would give is Um, the advice that I would give is see if you can get a hold of a clinic. Like we do have some students that come in and they do some clinicals with us. So if you can get into a pelvic floor PT place that will, do some training while you're in PT school, the clinicals, then first of all, that's awesome. Secondly, take courses. Just start taking courses and be aware that when you take most of these courses, this is like the deal breaker right here, is that you have to be prepared to be patient and clinician. So you're taking these courses and you're learning, and all of a sudden it's lab time. And so your notes come off the desk, the sheet comes on, the pillow goes on, everyone basically drops their pants, and you have to lay there and you have to, all your partners get to but that's the only way to learn. So a little bit harder for a male because you have to learn female first of all, and there were a lot of people in my classes who were like totally cool with having a guy partner, um, but you don't have the female anatomy over there to do the female portion. So you just have to take courses and become comfortable. And um, there's so much great information on Instagram right now. Our site, Pelvic Healing, has so much information. We talk about everything on there. And there's a lot of different um, Instagram accounts that, I mean, I to this day learn so much even from Instagram. So I find people to follow.
Yeah.
Hmm?
So you said it's pelvichealing.com.
Pelvic healing. Pelvic healing is our Instagram.
Yeah, and
Check.
my clinic also does We have a couple of pelvic floor therapists,
Uh,
specialists there. So I'm always like asking questions, and then some instances I just refer. I was like, I think they need a little bit more than.
so it was a pelvic healing. Oh, pelvic healing Instagram. Okay,
Yeah.
got that one. Perfect. Give it a follow.
So what were you saying? So you've got a couple people on staff at your clinic.
Yeah. So either some things are not looking right, or it was like one patient in particular, just a lot of abdominal pain, right along hip flexor mostly. I was trying everything under the book, and so I just went, and just like there was no change. So I was like, all right, I just had this conversation. I was like, I want you to hop on this to see one of the pelvic floor therapists.
Perfect.
And so, and then we transitioned in because I was like, a lot of these things I'm just like not able to do. I was like, you need some deeper look into things. So.
Was it abdominal pain? What was going on with that person?
It was more in like the hip flexor, psoas area, and every time they lifted their leg to get into the car, they were having just or rolling over in bed, just a lot of pain in that area.
Okay.
No tenderness to the touch, but just those motions hurt. So after a couple sessions, I referred them to pelvic floor.
Great. Yeah, and sometimes, looking at the hip and looking at things like labral tears, refer into the pelvic floor. So we have to sometimes, we're seeing pelvic floor, but is it really coming from the hip? You have to ask if that patient has had its surgeries. So what's going on in the fascial system, in the abdomen, because that all connects, like all that fascia comes down and kind of connects on here. And so if there's been any surgeries, we go in viscerally. I do a lot of colon massage and visceral mobilization and try to kind of like unstick everything. So look to see what's happening in her fascia there. I assume it's a female.
And I think having the conversation with the therapist afterwards, they dug a little deeper. This patient particularly had her appendix removed and had just a lot of
scar tissue. Mm-hmm. Yep.
So that they were starting to work on and trying to break through. So
makes perfect sense. I always ask about surgeries. And as I say, the abdomen gives so much information. I spend a lot of time on the belly. It gives a lot of information.
Yeah, I feel like the surgeries are so key and that's tough when I'm trying to like go through the history. I'm like, okay, so tell me every injury you've ever had. And it's like, okay, they only tell you the ones they think are important. I'm like, no, literally every injury, every surgery. And we'll go through like 40 minutes into the eval. And they'll be like, oh yeah, by the way, I had this like one surgery like last year here. I'm like, why didn't you tell me that?
Right.
I told you that for 40 minutes. But yeah, I think that's pretty key, is just showing how important like surgery is. Like that is a trauma to your body. Like they had to cut you open and do whatever. So like they may have fixed the structure, but it was like to get there's a lot of scar tissue that just alters the way you move everywhere else.
So true. So true. And sometimes it's so easy to release that kind of stuff. And then you look like this magician that, like they're like out of pain and they're great. And it wasn't even that hard to do.
Yeah.
Do you want me to give you a quick rundown on the pelvis real quick?
Please.
Okay. And you guys tell me when you've had enough of talking to me. Because I can talk about this all day long. Like I don't get tired of it. Here's our pelvis. These two bones up here are called the iliac crest. This is the acetabulum. Correct. The acetabulum for the femur to come in. So our hips are down here. The ilium come together at the pubic symphysis, which is a movable joint. We turn this guy around, and here is our lumbar spine, and here's our sacrum. We talked about the pudendal nerve coming from S2, 3, and 4, fusing together. diving into the pelvis. I don't have a pudendal nerve in here. We turn this guy around. Here is our sacrum, and here's our coccyx. Honestly, I don't know if these are supposed to be the sacrotuberous ligaments. I'm not sure.
That's what it looks like to me. The
Okay.
sacrotuberous ligament.
And then we've got the ischial tubes down here. Okay, so your butt bones when you wiggle around. So all of this rubbery stuff is the pelvic floor. And you can kind of see that these muscles, they sling from the pubic bone to the coccyx this way, and they sling from the ischial tube to the ischial tube. So they form a hammock at the bottom of our body. And the pelvic floor has several functions. They're very supportive. Every time you take a step, the pelvic floor is helping to stabilize your body. They have sphincteric functions. So here we've got the vaginal opening, we've got the anal opening, and in between we've got the perineal body. So the perineum is in between both. And the perineal body is basically this juncture of tissue and muscle, right? So we have got, and then when we turn our pelvic floor this way, we can see some of the deeper muscles. So these are the levator ani muscles. So these are more the Kegel muscles, which we'll talk about in a second. We talked about sphincteric muscles. So the anal sphincter is a sphincteric muscle. And I like to say this is a pelvic floor muscle. So if you're in an elevator and you've got gas and you gotta it's not appropriate to let out your gas, you're basically firing up your anal sphincter so that you can hold everything in, okay? So some of these are circular and some of these muscles are flat. So proper Kegel is a squeeze and a lift, okay? So when I'm trying to do strength training with my patients, I have my little finger in there and I say, I've just placed a blueberry in your vaginal opening. I want you to squeeze the blueberry. And now I want you to draw that blueberry, suck it up a straw to your belly button. So I'm having them squeeze and then I'm having them do a lift, okay? Basically, there are 3 layers of muscles of the pelvic floor. There's the superficial layer, which are these circular muscles. These are called the transverse perineal muscles. Then there is the second layer, which you can't really see, but they have to do with the urethra. So they basically help to open and close the urethra for proper urinary function. Then we've got the third and the deepest layer, which are the levator ani muscles. So these are pubococcygeus, iliococcygeus. We also have inside the pelvic floor, and coccygeus is back here, we have the obturator internus. So obturator internus is an external rotator of the hip. So I basically can put my finger in vaginally or rectally, and I can give a little bit of pressure to the outside of their knee and say push into my hand, and that muscle belly just pops into my finger. So obturator internus is inside the pelvic floor. So the piriformis and the obturator internus form the lateral walls of the pelvic floor. So we have to look at what's going on with those muscles too. Okay. That's kind of it. I mean, obviously we've got the urethra up here. We've got the clitoris up here. This is the ischiocavernosus muscle. This is a superficial muscle. You can see how this muscle is up the pubic bone, and what's on the other side of that pubic bone is the adductors. So sometimes when those adductors and all that tissue is super tight, the law of physics, it kind of pulls on some of this tissue. So we have to look at that. What's on the other side of the ischial tubes are the hamstrings. So we have to look what's going on with the hamstrings. So, it's the pelvic floor is intimately related to everything.
Oh, wow. Yeah. Thank you for the review.
Yeah. Sure.
I do have a question of this orgasm. So I did get a question. This girl gets an orgasm every time she does leg lifts. So she's trying to work out in the gym, trying to do leg lifts for her abs, but hates doing it because she gets an orgasm.
Okay.
So is there a way around it? Because I was my first thought was, well, maybe you can't do abs at the gym.
Okay. So that's an interesting question. And she needs to see a pelvic floor physical therapist, because something is going on there. So remember we talked about those 3 terminal branches. I just did a PN course the other day. We had to like do a project. This past weekend I did a pudendal neuralgia course. So we had to do like this project. And basically this was the pudendal nerve coming off the sacrum over here. And these are these 3, oh, I'm sorry, wait. Here we go. Here's the sacral nerve roots, and here's these 3 terminal branches. And basically, okay, here's the tailbone. And basically this branch here is the dorsal branch of the pudendal nerve that goes to the glands of the penis and goes to the clitoris. So there's something out there called PGAD, which is it's a misfiring of the dorsal branch of the pudendal nerve. It's a genital arousal disorder. Okay? So the fact that she's having an orgasm with leg lifts, I would try to see what's going on with that dorsal branch of her pudendal nerve that's innervating that tissue by her clitoris. And maybe she needs some other stuff cleared. So she's doing leg lifts. It's really interesting. I'd have to see kind of where this is all kind of piecing together. So we have other nerves coming in. We have the iliohypogastric nerve coming in. We've got the genitofemoral nerve coming in. So there's other nerves coming in to play around the tissue of the pelvis. And those nerves are obviously coming from L1, 2, you guys may know even better than me. Basically L1, 2, I believe. So something's going on there. I would be looking at her spine. I would be working the tissue around her spine. I'd be seeing what's going on in the pelvic floor. I'd see what is being compressed even internally that is firing up that dorsal branch of the pudendal nerve.
Oh, thank you.
PGAD, persistent genital arousal disorder. There it is.
Oh, okay. I think was there actually a story about a guy that happened to a while ago where he couldn't go. He was at his dad's funeral and has that problem where it's like he can't just stop orgasming.
Yeah, he needs a PT.
Yeah. And that was one of the lectures I listened to on the APTA pelvic section. One of those lectures was over that.
Yeah, it's really fascinating. You know, I have a patient who had PGAD, and she had pelvic floor dysfunction, and we kind of fixed everything. And then I did like a lot of skin rolling, like up and down her labia and like in the mons of her, the mons above the her vagina and her vulva, and we got rid of it all. And but it happens even with kids, like with children driving in the car and all the bumpiness. And so this is something that can even happen with children. Again, not normal. So it's something she should be able to figure out how to deal with that.
Well, I want to say thank you for coming on and even like explaining to us, because there's a lot of stuff I did not know about pelvic floor PT
Sure.
at all. So thank you for kind of spreading the word a bit about that too.
Yeah, I really appreciate you guys having me on and talking to me and letting me just talk about the things that I love the most. So aside from my husband and my children.
That too.
Yeah.
Perfect. Thank you so much.
You're welcome, guys. Take care. Good luck with everything, and just reach out to me at any time about patient questions that you may have, or or any other information you want to know.
Oh, thank you so much.
Okay. All right. Take care.
Bye-bye.
Bye.